Hi, my name's Morgan. I'm going to be doing a head-to-toe nursing assessment today with Christy. I'm just going to pan the room for you guys really quick. You might want to go show the see. Okay. Okay. So I'm going to start off by asking you some questions. Can you tell me what your first and last name is? Christy Burrows. Okay. So I washed my hands. I checked my chart. I provided my patient with privacy. And what's your birthday, Christy? December 5th, 1974. All right. So I just want to go ahead and ask her some questions because I think I already said that, but okay. Are you sick right now? No. Okay. Are you taking medications? Do you have any allergies? Have you ever had surgery before? Okay. Have you ever experienced any bodily trauma? Nope. No. Okay. How about head trauma? Concussions? Do you ever have headaches? Do you ever feel dizzy? Okay. I'm gonna move this a little closer so you guys can hear better. Stop. Because the volume kind of sucks. Alright. Okay, so I'm gonna start by inspecting Christy's head. And I already asked her if she has headaches or if she feels dizziness, and she said no. So I'm just going to look at her hair, and I'm just looking for any bruises or lesions or masses or bumps or infestations. And she doesn't have any. And then I want to look at her head shape, and it's normocephalic. Can you smile for me? How about your cheeks? Make that nose. Okay. Right, and now I'm gonna like this. So I'm palpating her temporomandibular joint, and I didn't feel any cracks or clicks. So that means cranial nerve number 5 is intact. And now I'm palpating her temporal artery, and I did feel it. Okay, so now I want to move on to your eyes. Okay, I'm just going to check for perla. Okay, so both pupils are equal round, reactive to light. So that means that cranial nerves 3, 4, and 6 are intact, but I think we have to accommodate also. And her pupils are about like a 5 or a 6 millimeter. Okay, so I want to check your conjunctiva. It's moist, it's pink, your sclera is white. I don't see any opacities. There's no lesions on her eyes. Okay, so I'm going to move on to your nose. It's symmetrical to your face. Can you block one nostril and go and then the other side? Okay, so olfactory nerve number 1 is intact because she has patency. Okay, I'm going to take a look inside. Okay, there's no deviations. It's pink and moist inside. I don't see any, I think it's just deviations or anything strange or obstructions in there. There's no lesions, and the nares are symmetrical. Okay, so now I'm gonna, you don't have any nasal problems, do you, or eye problems? Okay. If she did have eye problems, I would recommend using a Snellen truck. And cranial nerve number 2 is intact if she can see. Okay. Right? Okay. So now I'm going to move on to the mouth. Okay. So I want to start with the lips. I want to see that they're symmetrical and that there's no lesions. They're pink and moist. And I'm going to look inside the mouth. Okay. So her buccal mucosa is pink and moist. Okay. Stick out your tongue and say ah. I'm going to check your tonsils. The tonsils are a +1. And when she stuck her tongue out and she said ah, and her uvula and her soft palate raised, that means that cranial nerves 9, 10, and 12 are intact. So now I'm going to check her neck and her lymph nodes. Okay, so I'm just looking for jugular vein distension. And there's none. Okay, so I'm going to check her lymph nodes. So I'm going to palpate the preauricular, postauricular, occipital, supraclavicular, submandibular, submental, tonsillar, superficial cervical, and post-cervical. And while I palpated, none of her lymph nodes were swollen. Okay, and then I'm going to feel your carotid arteries, a reminder, so I don't forget. Okay, it's about a +1 on the right, or yeah, the left side, her left side. And then a +1 on the right side, so it's equal bilaterally, both arteries. Okay, so I want to the ear. Alright, so I'm going to start by pulling on her pinna and then pushing on the mastoid process and then pushing on the tragus. Did you feel any tenderness? Okay, let's go on the other side. Push on the tragus, pull on the pinna, push on the mastoid process. Tenderness? No? Okay. Take a look inside. I'm looking for any obstructions. Everything looks clear. There's nothing in there that I would note. Okay. This side is clear also. Okay, so after doing that, I did the eyes, nose, mouth, ears. I want to move on to the thorax and the lungs. Okay, so I'm going to start with your posterior chest. Okay. Maybe like sit right here, like your butt here, and then that way we can see your back. And then I'll just make this back. Okay, so I want to start, I just want to look at her skin. So if her shirt was off, I'd be looking for any rashes or lesions or anything like that that's out of the ordinary, or bruises. Okay, and then I'm going to check her anterior posterior diameter. Okay, so it's 1 to 2. And then I also want to check for, I want to palpate for crepitus. And then I want to start with C7 and I want to percuss. And I want to go down 2 spots at a time. And I want to percuss over the entire lung field. So I'm not hearing any resonance, I'm not hearing any dullness. Okay, and I already palpated, there was no crepitus. And then I'm going to check for symmetrical expansion. Okay. I'm going to place my hands at T10, and I'm going to have her take a deep breath. Okay, so it expanded bilaterally, so it's symmetrical. And then now I'm going to do the tactile fremitus. So each time you feel my hands, just say 99. So the vibrations went down equally, they diminished equally down the lung fields. Okay, so now I'm just going to auscultate. And if she was an actual patient, I would auscultate her skin, directly on the skin. Okay, take a deep breath for me, Christy. Okay, and then I'm going to go to T8 and T6. Oh, wait, no, this T8 and then T6. T8 again. And T6. And then I want to listen to her apices too. Okay, so all of her lung sounds were clear. There was no adventitious sounds. I didn't hear any wheezing or crackling. Okay, so now I'm going to move on to the anterior chest. So I also want to ask you, do you have a cough right now, or have you ever had any sort of lung problems?
Nope.
No. Okay. Any trouble breathing ever? No. Um, no procedures done on your lungs or your chest area or trauma? No. Okay. All right. So now I'm going to inspect her interior chest, and I just want to look at it, and I'm also looking for the bruises, and I'm going to feel for the temperature. So she's dry and she's warm, like she's not diaphoretic or sweaty, and I don't see her in any respiratory distress. Her facial expression is normal. She's relaxed. There's no accessory muscle use. She doesn't appear to be in any sort of respiratory distress. Okay, so I'm going to palpate for crepitus. Okay, so I'm not feeling any crepitus. So now I want to percuss. Okay, so I'm going to find her clavicle, and then I'm going to go down to the second intercostal space on each side and just percuss. Alright. I actually can percuss right there. I already percussed on the lateral side, but I'll just do it again. Okay, so when I was percussing, there was no resonance, there was no dullness, nothing that felt strange. Okay, so now I'm going to auscultate. I'm going to do the same thing. I'm going to find her clavicle, and then I'm going to go down to the second intercostal space, and then walk down 2 spaces each time and rotate. Okay. Take a deep breath, Christy. Okay, so I already listened laterally. Okay, so her lung sounds were clear. There was no adventitious sounds, no wheezes, no rails, no rhonchi, no crackles. Okay, so I think that's it for, or I want to do the tactile fermentus on the front as well. Okay, so it diminished bilaterally down the lung fields. Okay, so that's good. So now I'm going to move on to the heart. Okay. All right. So, have you ever had any heart problems before?
No.
Do you ever experience heart palpitations? No. No accelerated heart rate. Do you ever feel dizzy or faint, like that's heart related when you stand up too quick or
Nope.
down? No. You've never had any heart issues. You weren't born with any heart issues.
No.
Okay. All right. So I'm going to start. And I am just inspecting her apical pulse for any heaves or lifts. And that's at the PMI, which is the 5th intercostal space, mid-clavicular line. So it would be like right about here, and I would just like inspect and palpate to see if I can feel it or see it. So I'm not seeing it, so I know that it's normal. Okay, so now I'm going to auscultate, and I want to do 5 different areas, and I'm going to start with the aortic, the right sternal border in the second intercostal space. Okay, I'm just going to go for it because I can. So I'm going to do the same thing that I did with her lungs. I'm going to find the clavicle, and then I'm going to find the second intercostal space by walking down. Okay. Okay, so S1 and S2 are noted. The rate and the rhythm is regular. And then now I'm going over to the pulmonic it's also in the second intercostal space on the left sternal border. Okay, so S1 and S2 are noted. The rate and the rhythm is regular. Okay, so now I'm just going to find Erb's point, which is in the 3rd intercostal space. So S1 and S2 are noted. The rate and the rhythm is regular. Okay, so now I'm going to find the tricuspid, and that is in the fifth intercostal space, and it's on the left sternal border. We're going to be right about here. Okay, so S1 and S2 are noted, and the rate and the rhythm is regular. And now I'm going to move on to the mitral, which is in the mid-clavicular line on the left. Okay, so S1 and S2 are noted, and the rate and the rhythm is regular. There's no extra sounds or murmurs during the entire cardiac assessment. I didn't hear any extra sounds or murmurs. Alright, so let me think what I want to do next. I did the lymph nodes, the head, the neck, the lungs, the heart. Okay, so I am going to go on to the peripherals. I checked your jugular vein distension when you were sitting. Do you want to lay down? And I'm just going to see if it fills really quick. Okay. So I'm just checking to see if her jugular vein fills when she lays down. Nope. It's not distended on either side. Okay, so now I'm going to assess her upper extremities for any edema and the color, and I'm just going to inspect her color on her whole body is, so far that I see, that's appropriate for her ethnicity. There's no bruises, no lesions. It's dry, warm. I don't see any edema on her wrists. Okay, so I'm just going to check her radial pulses. So it's about a +2 on the right hand. And a +2 on the left hand. So they're both equally bilaterally, and both of her arms appear to be bilateral, or symmetrical bilaterally. Okay. So now I want to do her lower extremities. I just want to do the same thing that I did with her arms. I'm just checking for any lesions or bruises, and I'm checking for the color and whether or not if they're symmetrical. And I also just want to check her popliteal pulse and if I can find it, and the dorsalis pedis and the posterior tibial. Okay. You want to lay down, and I'll just look at your legs really quick. I'm just checking, and I'm also checking for edema. You do the abdomen really quick too. Okay, so I want to check her ankles first for edema. Do they want to? Okay. I think you guys want to be able to see me. Okay, so I'm just checking her ankles for edema, and I'm not noting any. Her skin color is appropriate for her ethnicity. She's dry, warm. I don't see anything abnormal. Okay, no edema on this leg either, so they're both symmetrical, bilaterally equal. Find the dorsalis pedis. Okay, it's a +2 on her left foot, and the posterior tibial is about a +1. Dorsalis pedis. Okay, a +2, and then the posterior tibial is a +1. Okay, so both of her pulses on her feet and her legs are equally bilaterally, and her legs are symmetrical. One isn't larger than the other, and I don't notice any atrophy or skin color changes or edema. Okay, now I'm going to do her abdomen. Do you have a shirt on underneath? Okay. Alright. So, okay. So I'm just going to inspect your abdomen. I'm going to be looking at the shape. I'm looking at the contour, and her abdomen is flat. It's not distended or round. And I also want to check the color and the temperature, and it's appropriate for her ethnicity. I don't see any veins or bulges or masses. Okay, so for the abdomen, I am going to start by auscultating. And I'm going to start in the right lower quadrant. And I'm just listening for vowel sounds. Do you have any abdominal problems? Have you ever had abdominal surgery? Yeah. What did you have? How long ago was that? Are you recovering well? When was the last time you had a bowel movement? Today. Okay. So you have regular bowel movements. Do you eat okay? You don't have any allergies to food or any flare-ups that you would be alarmed about? Okay. Alright, so there was bowel sounds noted in all 4 quadrants, and they sounded normal. Okay, so next I'm going to percuss. And I'm going to do it in the same order, from the right lower quadrant up to the right upper quadrant to the left upper quadrant to the left lower quadrant. So the right upper quadrant it kind of sounds like hollowy, and I think it's because she had her gallbladder out on that side. It sounds hollow on this side too. It sounds hollowy kind of on the left side also. Okay. Okay, so it just sounded a little strange up here, but that's okay. It's to be expected. Okay, so now I'm going to start with light palpations, and I'm just going to assess her for any tenderness in her abdomen when I palpate lightly. Do you feel any tenderness? And I'm going to do it in the same order. Any tenderness? There? No? Okay, so now I'm going to palpate a little deeper and ask the same question. Any tenderness? No. Okay. Alright, so I think that we are done with the abdominal. Okay. So now I want to move on to the neuro and the muscular assessment. You don't have to sit up if you don't want to, because I'm going to do her muscular while she's lying down. Okay. I'm going to have you grab my fingers. And then squeeze as hard as you can. Okay, good job. So she has a good grip, and the range of motion on her upper extremities is good. Now I'm just going to check your lower extremities. Can you push it into my hand? Okay. And then raise your legs. And then just do it without. Okay. So she has good range of motion in all of her extremities. And then I want to check her Babinski reflex. Okay, on the other side. Okay. All right, so the Babinski reflex is intact. Okay. And then I would also assess her gait. And when she walked into the room, I assessed her gait, and I saw that she had full weight bearing, and she was walking well, so she doesn't have any gait abnormalities. So that's good. Okay. So as I was talking to her, I could see that she's fully alert. So on the Glasgow Coma scale, I would give her a 15. And when we were speaking, I could see that her thoughts were easily understandable, and she was logical. And let me see, her dress is appropriate for the weather. Her posture is erect. She's well groomed and she's clean. Okay, can you go like this for me? Finger to nose touch. Okay, and then I'm also going to have her do a heel to shin. Okay, and then I I'm going to have her perform the Romberg test, which is where she stands together with her feet and then closes her eyes for 10 seconds. Okay. Okay, so I can see that cranial nerve 8 is intact. Okay, I think I hit everything. Let me think for a second so I don't have to go back. Skin color is appropriate. I'll ask you a couple memory questions. What did you have for dinner last night?
Pizza.
Okay. Where did you go to school when you were in 5th grade? Okay, so I can see that her recent and her remote memory are both intact. Okay, so I think that's it. Thank you.